Right, now South Africa's COVID-19 daily cases have more than doubled in the past 24 hours. It comes as 14,271 infections were recorded yesterday, which is an increase of more than 7,000 cases since the last report. These new infections were largely driven by the Western Cape and KwaZulu-Natal, recording 3,701 and 3,603 cases respectively. In the same period, 473 new fatalities were reported, which takes the death toll to 76,247. 579 more hospital admissions were registered, while 9.1 million vaccine doses have been administered so far. To expand on this discussion, I'm joined now by South African Medical Association Board Chairperson, Dr. Angelique Coetzee. Dr. Coetzee, a very good morning to you. Thank you so much for joining us. We still have a long way to go to end the third wave. We heard Health Minister Dr. Joe Phaahla this morning speaking about how nationally the active cases of COVID-19 have decreased, but we're not yet out of the woods.
Good morning, and yes, you are correct, and the Minister is correct as well. We are definitely not out of the woods yet. We are, however, seeing in Gauteng a decrease in the numbers at primary healthcare level of people coming in with COVID-19. We are seeing more colds and flus coming in. Again, very important to all the people out there listening. Please, colds and flus, you still need to test, do an antigen test, make 100% sure that it's not COVID-19, especially the Delta variant. Difficult, you cannot clinically distinguish without an antigen or a PCR test. And if we can't get that right, it means we will still suffer with an increase in numbers in certain hotspot areas. So it's important to know your status at this stage if you are having an upper respiratory tract infection.
The Minister also spoke about how he will not at this stage be considering, looking at the lockdown level, recommending a relaxation at this stage. And of course, that comes with a lot of substance in terms of some of the big challenges we're dealing with. What are we looking at? I mean, we already know that when it comes to vaccination and the willingness to vaccinate, men are still lagging behind.
Yeah, again, fully in supportive of the Minister there. We have seen some news media from, I think, one of the schools in Free State, Grey College, is also now for the next 2 weeks going to work from home because of an increase in COVID-19 cases in the school. We have seen some of the Eastern Cape schools also reporting an increase in COVID-19 and the learners. And while we still have this problem, while we still have COVID-19 daily cases, anything above 1,000 per day, we cannot say that we are out of the woods and that we are safe, and therefore now we are going to wait now for the fourth wave. We are still not safe. You still need to wear your mask, still need to listen. I know, we know that people doesn't want to hear this anymore, but that is the truth. We are not out of it yet. We might see lesser numbers in Gauteng, but as you have mentioned, Western Cape and KwaZulu-Natal are seeing increasing numbers. Whether they are out of there for a third wave, we don't know, because the numbers are also relying on the stats and the data that is being reported on a daily basis. And if we don't report good data, then the data will be poor and it will be misleading, and you will think that we are better off, but we're not. Even the death numbers might be higher than what you are seeing.
Dr. Coetzee, you make mention of the Eastern Cape, and one of the developments that have come out of that province is the investigation now, which is underway on the high COVID-19 death rate in the Eastern Cape, with the World Health Organization now really trying to scrutinize the high COVID mortality rate there. What could be some of the contributing factors?
Well, again, lack of enough staff, lack of enough properly trained staff, nursing staff as well as doctors. So it's an infrastructure problem and an HR problem. As long as we don't train the nurses to do a PCR or an antigen test, and then once if you have done that, to correctly report it, and if you need to send it to a lab to follow the correct requirements for that, once if you don't have enough medical doctors, again, trained with the necessary infrastructure and equipment, you will see people die. As long as people who needs to go to a hospital, a clinic, or the nearest family practitioner doesn't have enough money for transport, doesn't have the means to get to in time to any of these facilities, we will see death rates going up. And I can promise you, again, those death rates are underreported. And there's no reason, especially if you are a healthy 30-year-old person, why you should die from COVID-19. If you have been in time to the doctor, to the clinic, been treated, been educated on your disease, you should be within 2 weeks out of the woods. If we don't do that, if we don't train, if we don't teach the nurses and the hospitals, if we don't improve our infrastructure, especially the public sector, we're not going to win.
Arriving too late for treatment was also one of the contributing factors regarding the Eastern Cape. And I suppose now, I mean, we're already over 500 days into the lockdown period, and the information and the way it's been received perhaps has now fallen off of those who were really scared at the beginning of COVID-19 and now, relaxed as a result of perhaps being vaccinated, some of them, or other factors, being tired of wearing a mask and complying to all the regulations. What would you then, going back, like to perhaps caution when it comes to monitoring one's body and understanding the changes that could be taking place? What is it that we should be looking out for?
Well, again, I think the emphasis has been the past year and a half on tertiary care, on hospital care. Everyone is advising and everyone is speaking about hospital and admissions, forgetting that more than 80% of your patients can be safely treated at home by a family practitioner. If, again, patient is in time, if we keep on telling the community, please, if you have a cold or something in your throat, making you cough, or a severe headache with a bit of fever and a bit of a blocked nose, immediately go and see your family practitioner. If we can start round about between day 4-5 with cortisone for the patients where it's necessary, I can promise you, especially the young patients, especially the ones that doesn't have any chronic diseases, we're supposed to get you through. And if we can look a bit better after our chronic patients, who is also severely neglected on their hypertension, their diabetes status, again, HIV, because everyone is focusing on hospital admissions. If we can get it right and get the communities and get the doctors and the nurses in a community engaged, try and train them what to look for, and get your community elders as well and get them to understand, then it will help. But we are hospital-centric focus, not focusing on the basics, the basic needs of patients who get COVID-19.
Very well. Thank you so much for your time, Dr. Angelique Coetzee, there, giving us, a bit of a breakdown on some reaction to what Health Minister Dr. Joe Phaahla had to say this morning when it comes to the face of COVID-19 in South Africa and the many miles that we still need to go ahead with in order to curb the high number of deaths when it comes to COVID-19.